Dr. Turner, tell us a little bit about your education and training.
Sure. Well, I think like all people, when you really have a passion for something and you find excellence in it, it dates back to some kind of childhood interest. And in my case, it was really pivotal for me, a health class that I had in high school. And so before that, I was athletic, I was active, but I was also kind of a chubby kid. I used to wear husky-sized clothing, and I used to have a bedtime snack of like 1 or 2 bowls of cereal every night. Like 8 o'clock, I'd be heading out to the fridge, grab some milk, hit the cupboard, see what we got. And I really liked Honey Nut Cheerios, for example, and it's still kind of a secret temptation, don't tell anyone. So that was like me before health class. And then health class, I thought was so cool because we were learning about the body, how's the heart work, muscles, bones, the nerves in your brain, your eyes. I mean, this stuff is fascinating. And then moreover, I remember one time they had us on a nutritional side of it, and they had us write down everything we ate for a day. Okay, so we had to read all the labels, write down the ingredients, how many grams of sugar, grams of fat, like the whole thing, right? And this was pretty eye-opening for me. And so I remember I was drinking a chocolate milk, and I'm like, oh my gosh, this thing's got 12 grams of sugar in it. And I was drinking 2 to 3 of those a day. Oh, that Snickers bar I had at recess, oh, it's got 10 grams of saturated fat, and that's not good. I'm eating like 1 or 2 of those a day. So I really made some major changes at that point. I started working out, running, eating right, and just basically started on a whole path of interest in health and wellness.
All right, give us a little bit more detail about how you decided on physical and rehab as your specialty.
Physical medicine and rehabilitation?
Yes.
Yes, absolutely. Well, I love it because it's a non-surgical field, and it has to do with rehabilitating people from their injuries. So my concept is, I will do everything possible with you, exercises, vitamins, supplements, injections if need be, to help rehabilitate you and avoid surgery. And most musculoskeletal problems don't need surgery, so therefore I can help most people.
So do you have any other specialty areas other than just the rehab medicine?
Well, yeah, I would say I have 3 areas of expertise or specialization. So one would be sports medicine and non-surgical orthopedic care. A lot about what I mentioned before, aches and pains, helping rehabilitate people. Some people are injured athletes, some people are just getting a little older, having some arthritis, or maybe pregnant, having back pain that didn't totally get better after the delivery, something like that. Another area of emphasis for me is fibromyalgia and chronic fatigue syndrome. Interestingly enough, being here in the community for over 10 years, I started to see patients who would also have these symptoms, and no one was really taking good care of them. Typically, the primary care would know that they had a problem, know that it was kind of complicated, not quite know what to do with these patients. A lot of times they would go see rheumatology, and they'd be told, you don't have lupus, you don't have rheumatoid arthritis, but we do know you have something, it's probably fibromyalgia. And then they're just sort of dangling. The rheumatologist didn't necessarily want to treat them either. So there was a space, and they really weren't being taken care of well at all. Moreover, I had some family members who have suffered pretty severely from fibromyalgia, from chronic fatigue, so I was personally motivated as well. So that's a big emphasis that I've developed over the years, and something I quite enjoy. The turnaround in the quality of life that we get can be tremendous, and is very gratifying. I think the last part that I'm quite interested in is men's health. And this is basically the concept of taking this guy who's getting a little older, right? And his primary care doctor is saying, you know what, your blood pressure's getting high, your blood sugar's a little high, you're a little bit overweight. And he's telling the doctor, yeah, my sleep is not great, I'm kind of fatigued, I'm a little frustrated with life, maybe I'm a little depressed, and kind of giving him a men's health makeover, right? Like, how do we get this guy feeling like he did 10 years ago?
What motivates you?
What motivates me? I would say, in a word, it's kind of my spiritual foundation, and in a word, I would say it's God's love. That's the concept. That's what motivates me. When I go to work every day, I'm thinking, God's gonna bring some people into my path who need their problem solved, right? They're by definition in some kind of physical pain or distress. On top of that, there's some emotional suffering that's going on, right? This is causing a problem for them. There's activities in life that they can't participate in. This is costing them money towards medical bills that they really can't probably afford, right? And this is weighing them down emotionally. And so I'm thinking, I need to show God's love for this person to help bring them some healing, to help put together some things that are broken right now, and to encourage them kind of from the inside out that they're special, they're listened to, they're cared for, and there is hope for them.
All right, is there anything else that you'd like to tell us about either you or your clinic?
Well, I'm here in the community, and I'll be staying. I enjoy what I'm doing, and so I look forward to working with you or someone, and together we'll do our very best to get you feeling better.